Let's talk about lung health. This is such an important development. A lung nodule can sometimes show up unexpectedly on a CT scan. And while many are not cancerous, some do need a closer look. So Touro is now using this new technology that helps doctors reach and biopsy suspicious nodules even when they're located deep into the lungs. So Dr. Diana Espinoza, interventional pulmonologist with Touro and Tulane, joins us this morning to explain how this works. Thanks for being here.
Thank you so much for having me.
So tell me how much of a game changer this is for someone that has a nodule on their lung. Why is this surgery so hard?
So it's very important for us, it become a very minimal invasive procedure. Now we have the ion technology that uses a very small and thin catheter that helps us to navigate towards those very difficult to reach areas or pulmonary nodules. And
so the thin catheter enters through where?
Through the mouth. Like the patient goes under general anesthesia, no cuts or incisions are made, and we just navigate towards the lung or the area of the concerning, and then just take the biopsies.
So to appreciate this, you have to understand how it was done before this, or how it's still being done until this becomes standard practice. How do you biopsy a nodule in the lung now?
So before, patients used to go under invasive procedures. Sometimes they had the complications like pneumothoraxes when sometimes goes from outside or small incisions. But nowadays the patient is a minimal invasive bronchoscopic procedure. The patient goes under general anesthesia, no cuts or incisions, and the patient usually goes home the same day of the procedure.
The same day. How long have you been waiting for this technology as a pulmonologist?
Really for a long time. Before, we were not too good to sample those nodules because we didn't have the best technology. So unfortunately, we were not able to chase those nodules like 5 millimeters or 6 millimeters that we do nowadays. So we wait for a long time, and this technology started like 5 years ago. Hopefully all the hospitals are able and physicians able to do these procedures nationwide.
Is it already at Touro and at Tulane, or is this something that you're still waiting on?
No, we have in the 3 hospitals at University Medical Center, East Jefferson, and Touro.
Wow. Talk about the conditions that are in Louisiana. We know that, for example, military veterans suffer with injury from burn pits where they've had to inhale all of these toxins for so long. That's one cause. Also, smoking is very big in the South still. What conditions can lead up to needing a biopsy of a nodule?
So every patient who have history of smoking needs to go in the cancer screening program.
Okay.
However, physicians were trying to work to expand this lung cancer screening because we are now identifying risk factors, not just smoking, like secondhand smoking, exposure to chemicals, and the same environment or genetic factors that put you on a risk. So hopefully we change the guidelines in the future, but for sure people who have lung cancer history of smoking is very important to enter in the lung cancer screening. So we do CAT scans, is a specific type of images, and we are able to detect those small pulmonary nodules before they become big masses or late stage of cancer.
Wow, what a game changer. Dr. Diana Espinoza, thank you so much for being here.
Thank you so much for having me.
Absolutely.